Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Atrophic rhinitis, and we're looking at the etiology. So atrophic rhinitis is divided into primary and secondary. So let's look at primary first. So primary atrophic rhinitis, it may be due to the hereditary reasons. That is, it involving more than one family member. Then other causes, it can be endocrinal causes. That is, it is more common in terms of the females, and it starts at puberty and regresses after menopause. So it will start at puberty. So it starts at puberty and then it declines after the menopause. Then it may be due to the racial. Racial is that it is more common in terms of the Mongoloids as well as the Caucasian races. Then nutritional deficiency. In terms of nutritional deficiency, it is the vitamin A, D as well as the iron deficiencies. Next is it may be autoimmune. So autoimmune is that the antigens of the nasal mucosa. Antigens of the nasal mucosa. And it can be due to organisms. So organisms such as the Klebsiella ozanae. So Klebsiella ozanae. Next is we move on to the secondary atrophic rhinitis. The secondary atrophic rhinitis is there are specific infections. So specific infections such as the syphilis, lupus. So the syphilis, there is presence of lupus, the leprosy as well as the rhinoscleroma. We are writing it as RS. Next is the long-standing purulent sinusitis. The long-standing purulent sinusitis. Then the other etiology, it may be due to the radiotherapy. This is of the nose, and also there can be excessive surgical removal. So there's excess surgical removal. So excess surgical removal of the turbinates, and it may be due to the diphtheria, diphtheroids. Next is the Proteus vulgaris, then the E. coli. So diphtheroids, the Proteus vulgaris, the E. coli, then the Staphylococcus as well as the Streptococcus. So then the Staphylococcus as well as the Streptococcus. To learn and grow daily like this, please do subscribe.